Sunshine, it's our sunshine.
Hi everyone, I am Dr. Sukesh Rao Sankineani, consultant arthroscopy, sports surgery and shoulder surgeon in Sunshine Hospitals, Hyderabad. Today I am going to talk about knee injuries in sports persons. So as you all know, increasing number of sports activities taking place, knee injuries were very commonly seen in our young adults. They can range from a single knee sprain to a fracture to a multiligamentous injury. So whenever anyone has a knee injury, put an ice pack, splint the knee in the form of a brace or a bandage and rush to the nearby doctor, where you will be subjected to an evaluation. Some x-rays will be done, and if there are no fractures, then what you are given is rest, ice pack application and compression therapy and some painkillers. So usually most of these injuries they resolve in 1 week and you can go back to your activity. But in some patients, especially if you hear a popping sound or if the pain is very severe or there is a gross swelling or you are not able to walk, then that means you should be evaluated further. So then you should visit a specialist in the form of an arthroscopy or a sports surgeon. So the doctor will initially see you, evaluate you, and if necessary will conduct an MRI examination, which gives us a better idea regarding the soft tissue structures around the knee joint. The injuries can range from an ACL tear, PCL tear or a collateral ligament tear. Most often these injuries are initially managed conservatively by non-operative management, but some patients, a certain percentage of patients do not respond to these maneuvers, so they will require a surgery. This can be an open surgery and arthroscopic surgery. These days with the innovation in technology, we can do arthroscopic surgery, which is nothing but a keyhole surgery. We put a camera inside your knee joint, we evaluate your entire joint and do the surgery within the joint itself. So the most commonly performed surgery is ACL reconstruction. The other surgeries include PCL reconstruction, which can be again performed arthroscopically. The surgery around the collaterals is an open surgery again. Usually patients after this surgery recover in 3 to 4 weeks and get back to work after 1 month. In fact, most of these surgeries are performed as a day care surgeries in our hospital.